Welcome to module number 2. In this particular module, we shall be covering steps number 2 and 3 and the associated actions that would help us develop the strategic outline case, which is the key output of stage 1 of the business case development. Now, as we go through this module, I would like you to make note of the various workshops that we conduct. Please make note of the assurance activities that we carry out. And the key objective of this particular module is to have a robust case for change. In other words, we have quite a mature strategic case and economic case being developed as a part of the strategic outline case. Now, also as a part of this module, please keep in mind that you would need to work on a few exercises based on a sample case that would be provided to you. So please take cognizance of the case study and the various workshops that you could work on to get some hands-on understanding of developing a strategic outline case. Now let's kind of do a bit of deep dive. So this particular module covers steps number 2 and steps number 3. In step number 2, we make the case for change. So as a part of making the case for change, we agree the strategic context. We determine the spending objectives, the existing arrangements, and the business needs. We determine the potential scope for the scheme, and we determine the scheme benefits, risks, constraints, and dependencies. These are the actions pertaining to step number 2. Now let's kind of do a deep dive into each of the actions. So as a part of action number 2, we agree the strategic context. We provide an overview of the sponsoring organization. Let's say, for example, if it is the transport organization of a country, a bit of an overview of the transport organization. If it's a healthcare organization, an overview of the healthcare organization in terms of their vision, mission statements, what are the strategic goals, business aims, and key stakeholders. To a large extent, a lot of this data is available on the organization's website. And the range of services that are presently being offered, including key customers, service levels, customer demand, and annual turnover. Let's say, for example, we are working on building a new hospital. You might want to kind of look into what are the existing services being rendered by the current hospital, who are the key customers, service levels, the demand and annual turnaround, etc., are an important aspect of consideration. What's the structure, including staffing and governance arrangements? What is the existing financial position, including funding statements and level of spending? So this would be an important aspect of providing a strategic context. And also alignment with existing policies and strategies, all relevant international, national, regional, sector, and local policies, initiatives, and targets would be articulated over here. How the organization's policies, strategies, and work programs / projects support these policies. And what's the relationship between the proposed scheme and the other programs and projects within the organization's strategic portfolio. Good to kind of give a context of the project or the program within the larger portfolio of investments. So those are some key aspects of thinking in action number 2. And then in action number 3, we determine the spending objectives, the existing arrangements, and the business need. So when we think about spending objectives, we need to kind of make sure that we articulate them into smart spending objectives, objectives which are specific, which are measurable, which are achievable, reliable, and time-bound. And so that is one of the key aspects of thinking in action number 3. We articulate the spending objectives, and we articulate what is happening currently, what is currently happening. What are the existing arrangements? How are services being currently organized and provided to customers, associated throughput, turnover, and existing cost? current asset availability, utilization, and condition are all aspects of the BAU as of today. How are things happening? And then what is required to close the gap? That's your business need. Clearly understand the problems or difficulties with existing arrangements, consider service demand and capability planning, and the opportunities for bridging existing or future gaps. Now let's kind of do a further deep dive on what these spending objectives are. Now, broadly speaking, BBC breaks down spending objectives pertaining to 5 key drivers. We could spend to bring about some effectiveness in terms of improving the quality of public services by delivering better social outcomes. We could invest to drive efficiency, in other words, to improve the delivery of public services by the better use of inputs and outputs. We could invest to reduce the cost of public service. That would be an economic driver. We could invest to meet regulatory, statutory, or organizational requirements and accepted best practice. That would be a compliance driver. Let's say, for example, we would like to implement a new instrument tracking solution. Why? Because the industry is regulated by a tracking standard, and all hospitals would have to comply with the instrument tracking regulations, and therefore we undertake this particular project. So compliance is another reason for investing. And finally, replacement, reprocuring services in order to avert service failure. Let's say, for example, the existing asset is coming to an end of service. We would need to replace that. Another example would be, we are working with Air Force of the country, and the existing fleet of aircrafts, are kind of reaching the end of life. So we need to kind of make sure that we have good infrastructure to patrol the maritime space, and therefore we would like to replace the older aircrafts with new aircrafts. So those are some examples of replacement drivers. So here we have an example of an electronic health record context. So when we think about implementing a health record, we might want to kind of improve the quality of care. That could be a driver. We want to enable effective access to clinical and administrative information. That could be another driver. Let's say, for example, the hospital might have information fragmented across multiple services and departments in terms of each department using a specific tool or work being done manually. And therefore, the need for us to reduce that fragmentation, and hence we are investing in the electronic health record initiative, for example. Another example would be to improve health policy development and research. So we've got a few examples. When we think about SMART objective, it's good to kind of be very specific. For example, one of the objectives could be to improve the quality of care and experience of patients by a particular date through the provision of a single patient record. It's specific, and it might be related to the effectiveness driver. An example of an economic driver would be, we would like to invest on electronic health record, but because we would like to reduce the fragmentation of care and cost by 20% by a particular date. That could be an economic driver. An example of an efficiency driver would be to increase the throughput of patients by 10% each year between 2007 to 2009. So it could be an example of an efficiency driver.